Good morning. My name is Eva Venes. I'm a Pilates instructor and a corrective exercise specialist located in San Diego, California. I specialize in working with people who suffer from chronic pain and or have some kind of chronic condition. You may or you may not know that I ran a telesummit earlier this year. It was called Pain Free for Life. Pain Free for Life Summit had a huge following, and up until this day, I receive emails and phone calls from people. They ask me to continue exploring the topic of chronic pain. This is why I organized this second telesummit called Heal Your Chronic Pain, because I want you to meet the top experts, the most brilliant people in the health and wellness industry, so they can tell you where your chronic pain stems from and what they can do in their practice to help you eliminate that pain. In my Pilates practice and in my online coaching program, I meet people on a daily basis who suffer from chronic pain. They usually have multiple pain areas, and they know very little about who to turn to and what they can do besides drugs and surgery. This is why I brought today's speaker, Dr. Gill Kojiki from www.valleythyroidinstitute.com. I want you to meet him and I want you to hear his advice. Dr. Kojiki, good morning. Thank you so much for joining me on this summit.
Thank you, Eva. Good morning to you.
Would you please introduce yourself? Tell us who you are and what you specialize in.
Sure. As you mentioned, my name is Dr. Gill Kojiki. I've been a chiropractor for 30 years. I've been a functional medicine doctor for approximately 8 of those years. And when I first started in chiropractic back in 1985, I was a musculoskeletal chiropractor. So I treated people's pain, neck pain, back pain, headaches, but I treated it from a musculoskeletal postural perspective. My specialty was postural correction. And so I practiced a technique called chiropractic biophysics, which is still out there today. But that's how I took care of people's pain. My philosophy was that it was physical musculoskeletal pain caused by postural distortions, and I got very good at correcting people's postures, making actual changes on their x-rays, helping them with their headaches, their neck pain, their back pain, and I was very successful at it for about 22 years. Then roughly, about 12 years ago, my wife came down with Hashimoto's, which is an autoimmune thyroid disease where your immune system actually attacks your thyroid. I know this has nothing to do with pain, but what I'm going to tell you is this is my transition into a different world of healthcare. So I had started studying functional medicine and nutrition at the time. She got this diagnosis of Hashimoto's. The doctor's remedy for it, treatment, was just thyroid medication forever. Well, that wasn't good enough for me. So I contacted some colleagues who were better than me at it, and through natural medicine and nutrition and herbal compounds, vitamins, minerals, enzymes, we completely reversed her Hashimoto's. All her thyroid symptoms went away, and that's where I started slowly going into all functional medicine. So here I am now, 30 years into my career. I do mostly thyroid and autoimmune conditions. Now, what I found out, though, was that these thyroid people, probably 40 to 70% of them have some kind of body pain. They've got headaches, neck pain, back pain, body aches. They've been diagnosed with fibromyalgia. They've been diagnosed with inflammatory joint conditions. And that almost becomes secondary or tertiary to their thyroid condition. And so what we're finding out, though, is that pain is not just physical. It's biomechanical, it's chemical, it's nutritional. And so now I start moving more into the nutrition and the herbal compounds and helping people with their pain through nutritional and herbal compound methods.
Wonderful. Dr. Kajiki, what are the most common aches and pains and health problems that people turn to you with?
Well, for me, as seen mostly thyroid people, they have this nondescript body pain. It just kind of hurts all over, like they were thrown out of a truck while they're driving on the freeway. So they've got this overall body pain, yet now they also have specific pains like foot pain and heel pain and joint pain and shoulder pain. So they have this overall body pain plus these very specific points of these body pain. And I've actually invited a patient along to speak. I think she might even be online right now to talk about her experience as well.
Yes, she is. Hello, Dan. Thank you so much for
Hi.
joining the call today.
You're welcome. Thank you. Sorry.
Um, Dr. Gill, my next question would be, do you have any miracle stories that you would like to share with us? So Don joined us just in the perfect time.
Yes, actually, and Dawn is really one of my miracle cases of a pain reduction because she saw me for really a thyroid condition. Now, she had this overall body pain, and I didn't even really know how bad her pain was until she actually told me this. And I'm going to let her actually tell the story. But I didn't even know she had this body pain. A lot of people complain about body pain, but I had no idea how bad it was, how chronic it was, how debilitating it was to her life. And so through just nutrition and de-inflammatory supplements, my goal was to calm down her inflammation. And how her body responded to that, I didn't know. But my goal was not to get rid of her pain. My goal was to calm down her overall systemic body inflammation. And she just had incredibly, tremendously great response that I really want you to hear about that.
Don, please share your story with us.
Um, I've had issues my whole life, and they've always diagnosed me with depression, anxiety. It got pretty bad about 4 or 5 years ago, and I continued to go to family practitioners who just kept putting me on more antidepressant medication, but the pain wasn't going away. Um, so we went to multiple doctors. We couldn't find any answers. My husband went online. He found books on pain, and we did diets. We did Stop the Thyroid Madness. Finally, somebody steered us to an endocrinologist. So I went to an endocrinologist. I'm sorry. Um, anyway, I went to an endocrinologist, and I was with them for about a year, and they put me on thyroid medication, levothyroxine. Um, and I've been doing it for about a year, and the pain still was not going away. Now, when I mean pain, I mean all over body pain, to the point where it got so bad, my life was basically lived between my hot tub and my bed. My husband got me a new bed that would rise, the legs and the back would rise up so I could position myself where I was in less pain. It had a motorized massage on it to help with the pain, but still, I was basically trapped in my home for the worst it got. I never left my house for a year. The last year before I met this doctor, I did not leave my house. I attempted suicide twice. I was hospitalized um, for it, and again, they treated me for depression and anxiety, and they never did anything about the pain. So I finally just got to the point. I told my husband, if you can't find somebody to help me, I just want to get my affairs in order and be done, because my life was gone. I missed my youngest daughter's senior year because I couldn't leave the house. I couldn't go anywhere. The pain was just too intense, and I would cry in a car. I would cry when I would get there. I couldn't handle it. So I just was to the point I just couldn't take the pain anymore. And he found this doctor online. He was desperate, and we did a phone consultation with him. We talked to him about all the things that he was going to do that all the doctors hadn't been doing for me. Um, it took us a week to talk it over, because it's a huge decision to go with somebody that you don't know, that's, over the internet, so you don't see him and everything. And we didn't really have a lot of faith in doctors anymore. But he put me on this strict diet, and he put me on anti-inflammatory medication. Now, the thing you need to know about me is when somebody tells me to do something, I don't do it halfway. So I didn't cheat on anything with the diet. Whatever he said I couldn't have, I did not have it. The most I would do is a half a Pepsi if I had a migraine headache, but that was it. And I really limited myself on that as well. And within three weeks, the pain was gone. I mean, I can leave my house now. I went to visit my dad, who lives 4 hours away, that I hadn't seen in 2 years because I couldn't drive that far. I was able to go to my grandson's grandparents' day at his preschool, which was 6 hours away. I stayed there for the whole weekend. I came home and I was fine. Where before, if I would have traveled that far, I would have been in so much pain for a week. A lot of times I would go to the emergency room just to get medication, and they would give me oxycodone or something like that for 5 days. So I would get 5 days of relief from the pain. That would be it. And people look at me and they didn't see that I was in pain. They couldn't grasp it. They couldn't understand it. My husband finally started to understand it because he would sleep with one eye open, scared that I was going to take my life because I couldn't handle the pain. I wasn't sleeping. I would cry for hours on time. I mean, and it wears a person down, being in constant pain. You get no relief whatsoever. So when I met this doctor and he told me what to do, I did it full force. I did everything he told me to, and within 3 weeks, and I'm pain free. I did my hair for this thing. I could not do my hair before I met this man. I couldn't hold my arms up. Nothing. I couldn't do makeup. Nothing. I lived in sweatpants, sweatshirt, and in my bed. That was my life.
Dan, I don't even know what to say. This is just amazing, and I'm so happy for you that you got your life back.
He saved my life. He saved my family. He saved and we are just starting. I still have problems, but the pain is gone, which excites me to all the other things that he's going to do for me. It's amazing.
Yeah, that's such an incredible story. Nobody could tell it like you.
It's very powerful. I'm just shocked.
Yeah, you're giving people who are going to be watching this a lot of hope that there's always an answer. It may not be apparent right now, but there's always an answer out there.
And don't give up. I went through this for 4 years. 4 years. And finally, I found somebody that cared enough to help me. So you can't give up.
Thank you so much for doing that, Don. That was amazing. That was really amazing.
Thank you. I look forward to talking to you later.
You're welcome. Thanks again for being on this for us.
You're welcome. Bye.
Bye-bye.
Bye-bye, Dan. Thank you. Wow, I guess this says it all, but I'm sure you, Dr. Kojiki, will elaborate a little bit more on what Dawn said, how you helped her, and basically what is the process? How does one person get from one end of the spectrum to the other?
Sure. I can tell you that being a musculoskeletal doctor for so many years, I was convinced that all pain was physically in origin. And it probably is in many cases, but what I totally underestimated all these years being in practice was the power of nutrition and the power of metabolic nutrition towards inflammation, which ultimately would cause the pain. Now, there certainly is physical pain. You're going to have other practitioners talk about it from a physical perspective, and I myself thought pain was mostly physical. But I can tell you that since I started utilizing diet and nutrition in my protocols, my results now are better than they ever have been. I treat back pain and neck pain and headaches as an incidental side effect of what I do for the thyroid. People's neck pain and back pain and headaches resolve. That wasn't even my intention. It just happened as a side benefit of reducing the inflammation. And no matter what kind of practitioner you are, your patient has to eat. Okay. And so what I'm realizing now is that what you eat, how you eat, and what you eat makes a gigantic difference on your health status, especially your pain, especially your brain function. And I underestimated that for many, many, many years. I really had no idea how powerful diet is on your health. And it could really make things a lot worse and make things a lot better depending upon how you manage your diet. And it doesn't matter what kind of practitioner you are, you could help people with their diet, which you are ultimately helping with their inflammation. And that's the one thing that you do as a patient where you can dramatically affect positively or negatively your condition by what you eat, because you eat multiple times per day. People don't exercise multiple times per day. You're going to eat multiple times per day. And so the first thing I do with my patients is I address inflammation. Very first thing. And I address inflammation through their diet, and I address inflammation through different types of de-inflammatory natural supplements. Now, Dawn mentioned she was on anti-inflammatory medication. It's really not medication, it's natural supplements. I could tell you the two most powerful natural supplements you could take to fight inflammation are turmeric and resveratrol. They're very well studied in the literature that they are two very, very powerful natural anti-inflammatory supplements, and I give them a de-inflammatory diet. Now, I want to qualify something here right now is I never give generalized types of recommendations. Everyone is different. And so I'm giving these recommendations with some hesitation because there's going to be some people who follow these recommendations and it just doesn't work for them. You're right, because it's not for everybody. But what I do is I give them this de-inflammatory diet. And as a general rule, if you leave out these types of foods, at least initially, temporarily, it'll reduce the inflammation. So I have people leave out of their diet any form of gluten. Gluten is out. Soy, dairy, yeast, all forms of grains, corn, rice, beans, potatoes, nightshades. So if you leave out all of those types of potentially inflammatory foods, you're going to not feed that fire anymore in your body. And I can tell you, if you've got pain, you've got inflammation. You just have to figure out where it's coming from. Okay? Inflammation is natural for the body to heal, but sometimes the body can't control it and it just keeps going out of control and it keeps this inflammatory process. The next thing you do is you got to break this inflammatory cycle called NF-kappa beta. And this is a protein that's inside the cells. When this protein gets activated by the immune system, it causes systemic inflammation. But that systemic inflammation activates the protein, and the protein causes inflammation, and the inflammation activates the protein. So now you're in this vicious cycle of inflammation, NF-kappa beta protein, and you can't put that cycle out. You've got to break that cycle in two places. You got to break that cycle with turmeric and resveratrol, and then you've got to stop feeding the fire. And that's how we start off the process with virtually every single person on helping them with their chronic pain.
Dr. Kojiki, do you think chronic pain is difficult to treat?
Yeah, it's very difficult because you don't know where it's coming from. I mean, it could be chemical, it could be physical, it could be emotional, it could be metabolic, it could be nutritional. I mean, you as the practitioner have to determine where is the origin of that pain coming from. I'm sure eventually the nerves are getting fired up, but what's causing those nerves to get fired up? In my earlier years, I thought it was strictly physical. Now I realize it's emotional, it's physical, it's chemical, it's dietary, it's deficiencies. There's so many different areas that you can address pain with. That's the key. You got to find out for that person, where is the origin of that chronic pain coming from.
So basically, these are the underlying factors of chronic pain, right? We have to look at all of them in order to determine what angle we are going to approach the pain from.
Yeah, I mean that's the root cause, and I
Yeah.
mean I think no matter what type of practitioner you are, if you're treating pain, anybody can tell somebody stop eating these particular foods, right? And then you do whatever kind of psychotherapy or Pilates or stretching or chiropractic or acupuncture, you do whatever you want to do, but you can always influence it to a more positive end result by changing their diet.
Absolutely. I was speaking to a client the other day, and I suggested that she start seeing a chiropractor. And she said, I don't want to, because I just want to do one thing at a time, because if I do numerous different methods and approaches in the same time, I don't know which one works. And I told her, you need to care for your body in numerous different ways. It cannot be just one thing or the other, because we all contribute to the big picture. If you go to see your chiropractor for adjustments, if you follow a healthy anti-inflammatory diet, if you stretch, if you mobilize, if you learn how to use your body the proper way so you don't develop postural deviations and you don't develop faulty movement patterns, then all of these will contribute to the big picture. You can't just single out one method and only follow that.
Right. I agree. And you know what? Who cares what works? Who cares who gets the credit? This isn't a research project. It's you're trying to get rid of your pain. And whether it's one method or 4 methods, who cares? If it gets rid of your pain, then use all 4 of them.
Exactly. Dr. Kojiki, I'm sure that before you see many of your patients, they have already tried many different methods on their own. They go online and they see what they could do for their pain. What are the top mistakes that people make when they try to gain their health back?
Well, I know that people are desperate, which is why they're searching the internet. But I also feel like using Google as your doctor is a gigantic mistake. Okay, when you're using Dr. Google as your doctor, that doctor is not talking about Eva in particular. It's not talking about Gill Kojiki in particular. You're an individualized person. So Google doesn't know that. And so I feel that using the internet to guide your health care is a huge mistake. Now, using the internet to find people like Eva and find people like Dr. Kojiki, I think that's a great resource. But I think you need to get the advice of a professional. And whether it's somebody, if you choose the physical route, the emotional route, the chemical route, the dietary route, you need to find a professional who can customize a program specifically for you. I think that is the key if you're going to be on the internet looking around to help your health.
Thank you. We all know that good health is easier to maintain than to regain. Do you have any suggestions for people out there who don't have a ton of tremendous pain in their bodies? They just maybe have a little bit, some aches and pains, and they want to prevent that to grow into something much, much bigger. What should they do?
Yeah. Well, I think one of the first things I tell people is be very self-aware. Okay? Don't minimize your body ailments. So people say, oh, I get the typical acid reflux, or I get a typical headache. I just take an Advil for that. Your body is telling you something, especially when it comes to pain. There's a warning sign that your body's saying, hey, there's a problem. Look at me. Find out what's going on. Don't cover me up with a chemical and make the pain go away. So be very aware of what's going on in your body. Okay, because if you're not aware of it, then you can't work on it. And if you can't work on it, it's going to continue to get worse. Okay, your health only degrades. It doesn't get better if you don't do anything about it.
What is the healthiest diet, by the way? Are there any top, worst, and best foods that we should all eat and we should all avoid?
I'm going to defer to saying everyone is different. I can tell you that every single person is different. I can give my de-inflammatory diet to 100 people, and probably 96 of them it's going to be perfect for. and there's going to be 4% of them where it's going to be a problem. So I'm going to have to say that everyone is different, and that's why you need the help of a professional, because that person can guide you through what foods you think you're okay with, but maybe you're sensitive to. Soy is great for some people. It's horrible for other people. Broccoli is great for some people. It's horrible for other people. I'm more into staying away from the foods that are going to be harmful rather than going towards the foods that may help you.
Everybody should just experiment and just stay away from processed food. I guess that's the best.
Yeah, I mean, I think if there were a safe method, I would say buy foods that don't come with a label.
Mm-hmm. Shop at the market.
Yeah.
Dr. Gill, some people are so big on supplements and other people hate supplements. Do you think we should take supplements? And if we do, what kinds?
Yeah. You're talking to somebody who didn't believe in supplements. Okay, when I was a chiropractor, I would say, you don't need vitamins and you get it from your food. Well, you know what? That might have been true 40 years ago. But now our food has got pesticides, it's got chemicals, it's got hormones. Our soil is stripped of our nutrients. Our water is toxic. Our air is toxic. It's not the same. You cannot get the proper nutrition from food alone. It's just impossible to do. So you have to supplement. You've got to supplement with different types of vitamins, minerals, enzymes, amino acids. Now the key is, well, which ones? Well, once again, everyone's different. Okay, I use lab testing. Other doctors use muscle testing. Other doctors use hair analysis. Other doctors use blood. I do different types of lab testing to find out where some of the deficiencies are, where some of the overages are. For me, that's the most accurate way of knowing what kind of supplements you need is through lab testing. And I rarely give any kind of supplement recommendation unless I have a lab test to back me up on that.
I really like what you said, and I have to mention that most of my speakers come from that standpoint. They want they offer customized approach as opposed to just giving generalized advice to people, and I just really want to emphasize how important this is, and I'm very thankful for you for doing that, because everyone's different, as you said before, and we have to get a customized program for ourselves, because whatever works for the neighbor may not work for us. Dr. Gill, do you have any tips and tricks that people could use in their everyday life just to become healthier and have less pain?
Yeah, what I'm going to say is this, is use your common sense. Okay, we are all born with it. We don't always use it all, but use your common sense, okay? If your common sense tells you that alcohol may not be the best thing for your body to process and it's going to cause inflammation, cut down on the alcohol, okay? You probably know common sense says don't eat fast foods. If you have pain, this fast food full of preservatives and chemicals is only going to cause more inflammation. It's going to cause more pain. Stay away from the sugary foods. Stay away from the caffeinated foods, drinks. Stay away from the high carb foods like corn and rice and beans and potatoes. So anything that's going to potentially inflame your body is going to make your pain worse. So you don't have to be a nutritionist to know that you probably don't need dessert after dinner, right? Or that you don't need a bagel with cream cheese and jelly, that maybe bacon and eggs would be fine. So use your common sense. That will take you a long way. The other thing is this, people's blood sugar stability is horrible.
Dr. Gill, I lost the voice.
Oh.
Okay, it's good.
Oh, okay.
Can you just repeat your last?
Sure. People's blood sugar stability is horrible. Okay, you should be eating every 2 to 3 hours. If you make a habit out of skipping breakfast or skipping dinner or even skipping lunch, you're causing your blood sugar to drop or to surge. And you're having insulin surges, which is inflammatory, which will cause you more pain. Your body wants very consistent, even blood sugar throughout the day. So that's why I tell people, stay away from the high carb foods, stay away from the sugary foods, stay away from the caffeinated things that are going to cause cortisol rises. Do you have to be perfect? No, you don't have to be perfect, but you got to be perfect probably 80% of the time. So watch your blood sugar, use your common sense.
Thank you. This was really simple, very hands-on. Everybody can do it. I have to mention, I constantly think about my meals. I love to eat, and I'm a healthy eater. I constantly plan. I don't just wing it. I plan what I'm gonna eat today, but I'm gonna eat tomorrow. It takes a little bit of thinking, it takes a little bit of time, but you get into the habit. And after that, it's not that big of a deal. You just plan your meals and just shoot for the best. And as you said, Dr. Gill, we are not perfect. We're gonna make mistakes, but don't fall off the wagon. If you ate one bad meal, eat a really good meal after that, and balance it out as well as you can. Dr. Gill, are you working on anything new, anything exciting that you would like to share with us?
Well, over the years, I found out that I can access a lot more people if I go online. And so my practice now is strictly Skype and phone. And I work with people in Germany, France, Canada, even Thailand, Singapore, New Zealand, Australia. I work with people all over the world as well as all over the country. And now these people have accessibility to me. You don't have to come to my office for me to be able to treat you. I can do everything in front of you as well as I can 10,000 miles away. So, I mean, you can contact me at my website, Valley Thyroid Institute. You don't have to have a thyroid problem to work with me, but my specialty is thyroid. And one of the side effects of poor thyroid function is chronic pain. So we actually do help people with chronic pain as a side benefit of helping them with their thyroid.
So there could be people out there who don't even know they have a thyroid issue, but they do have pain. If they've never been tested for a thyroid deficiency, I guess they don't know if they have it. So that's probably a good thing to get checked, right?
Exactly. You don't know till you get checked. You got to do the lab tests.
Now, Dr. Gill, thank you so much for taking the time and be here with us today. I really appreciate your advice, and everything you said was wonderful. And I hope that people will contact you and use your services, because it sounds like you're truly wonderful, and you can really make a difference in people's lives. Thank you so much for being here with me today.
Yes, thank you.